am Dr. K Srinivas, Chief of Cardiology, VSH Superspeciality Hospital. Is a multi-speciality hospital situated in the heart of city Bangalore. See, the common thing people ask is, what are the immediate steps a person should take when he comes to know that he has an heartattack? So what actually happens is, it is the pain. You have to give some relief to the pain, and that is what is important, and avoid anxiety at that particular moment. Too much of anxiety is what kills a person. The pain is there, I know and understand that there is too much of pain, but if you encourage him to be more calm, relaxed and take it easy, then the results are better, rather than making him panic there and everybody running here and there, making the situation so dramatic, and that builds up the anxiety further. This building up of anxiety kills a person, because anxiety causes adrenaline to be secreted in high levels, and this adrenaline causes arrhythmias of the heart, because already the muscle is getting damaged and it is very irritable, and this adrenaline causes life-threatening arrhythmias like ventricular tachycardia, ventricular fibrillation and arrest, and that is the reason the young people die suddenly after an attack, and this happens within the first 1 to 2 hours after an attack. So this period is the golden hour, and we should try to take care in this hour. And recommend response to heart attack differ in the person is alone versus others. Yes, if you are alone, all the more. If you think that you have an heart attack, you should just try to reach you call for help, call people for help. Don't get panicked, don't get into the panic mode. Call other people for help, and then try to reach the hospital, nearest hospital, as early as possible. That is all I can tell you. And in case if you have an aspirin at home, you can crush the aspirin. About 150 to 300 milligrams of aspirin should be swallowed immediately, and then be calm. Try to reach the hospital at the earliest, nearest hospital, anywhere. And should someone take aspirin during a heart attack? Yes, aspirin does prevent the complications of heart attack. So it is, if it is available, if you have presence of mind, and definitely aspirin is worth taking if you suspect an heart attack. So what could be the potential complications of self-administering aspirin? So aspirin is a well accepted drug, and only complications of aspirin is that it can cause some gastric irritation and bleed. Otherwise, aspirin is a very safe drug which can be taken as a prophylactic or preventive drug in patients who suspect that yes, they could be having an heart attack. No problem. And how can the bystanders help or witness help in the situation? Somebody is experiencing a heart attack. If somebody is experiencing an heart attack, I request the bystanders to make the situation, make these circumstances very light, allow them to rest, and don't create a panic mode. And if you can give him a tablet of aspirin or a sarbitrate, if somebody has a sarbitrate in their vicinity, that sarbitrate can be kept under the tongue, and then give him enough space to breathe, and encourage him, and try to organize him taking to the nearest hospital. That is what I would recommend for the bystanders. And significance of performing CPR during a heart attack can guide us through the basic steps. See, CPR is a cardiopulmonary resuscitation is at a stage where when you see the person not breathing, if a person is not breathing due to so many other conditions, if he is having chest pain and he stops breathing, yes, you are supposed to do the CPR. The basic thing is that you should check the pulse. If the pulse is not there, falling 2-3 times, and he is not able to open his eyes and not breathing, then immediately you should start giving the cardiopulmonary resuscitation. So there are different methods of doing resuscitation. The basic simple thing is give a thumb or the precardium in front of the heart, front of the chest. You can give a thumb. Many times that itself will wake up the patient, or you can start pressing on in front of the heart and asking him to breathe, encourage him to breathe. And if somebody can give a mouth-to-mouth breathing also is recommended. And some is also thing which commonly asked is, can he drive with a chest pain? I would suggest no. If a person is suspected to have an heart attack, he better not drive. He has to take the help of somebody to reach the hospital which is nearest, because anything can happen. Better to be take precautions. Either call an ambulance, wait for an ambulance, enter the ambulance where immediate monitoring, immediate oxygen is available, and then reach the hospital. Not to drive, not to take strain. And what are the information should be relayed to the emergency responders when calling for help during an attack? So immediate numbers, or the hospital numbers, you can call and tell that yes, I'm having a chest pain which is lasting for more than half an hour. I'm suspecting an heart attack. So please send an ambulance immediately. That's all, simple word, and everything will be taken care by the hospitals, because it's widely accepted condition, clinical condition which needs an emergency care. And are there specific actions or procedures that healthcare professionals perform upon the patient's arrival at the hospital? So here I would like to say that heart attacks happen because of the closure of the artery supplying the blood to the heart. So that is what causes heart attack. So the treatment for that heart attack is restoring the blood flow. There are two methods of restoration of blood flow to the heart. One is injection called thrombolysis to break the clot. The second is angioplasty, primary angioplasty, which means that we identify which artery is blocked, and the blocked artery is cleared of the clot by means of a balloon and stenting. That is called primary angioplasty, and the success rate of thrombolysis is 50%. Success rate of angioplasty is 98 to 99%. So the choice is given to the patient that these are the two options available to immediate correction of heart attacks. So if whichever they are able to offer, we have to do. And at the same time, if the hospital is equipped with a cath lab with available cardiac team, then angioplasty is the best treatment for acute MIs. And thrombolysis is done when you don't have a cath lab, and when the patient is in a tertiary or peripheral centers, and there it will take some time to transfer the patient to the facility center. Then you can give a thrombolysis. So what should someone expect during the recovery process after surviving an heart attack? So after surviving an heart attack, once you establish the blood flow, entire pain, whatever severe pain he had, will subside, and patient start feeling good, and he almost becomes a normal person. So, but still there are complications which can come in the first 24 hours of the heart attack, like the muscle is damaged, heart pumping may be slow, or the irritability of the heart may be higher. So we need to monitor very closely in the CCO and then take care of these complications. And once these are all set, then patient is shifted to the wards and kept there for another day or two, and then he will be discharged home.